I would be a very strong advocate for the introduction of ACPs. I wouldn't wish to go back to a time when we didn't have them.
Okay, and when was the last stroke that you had? When you put that black qualified ACP lanyard on, you feel very visible.
We're seeing ACPs increasingly playing a critical part in the delivery of services on our wards and in our departments.
I think it's revolutionised the career pathway for nurses and AHPs.
This is about a workforce that has additional skills, and actually we're all one workforce that are there delivering healthcare to patients. Specialist medicine was our first division that developed a workforce plan really that included ACPs within it. This wasn't medical substitution, this is about a nurse coming in to do the doctor's job. It was about the start of enhancing our teams to make our team work look very different to how it has done in years gone by, where it's very clearly defined if you were a nurse, a doctor, a physio.
We needed the board to take a leap of faith really, that this was going to be a long-term solution to quite a difficult problem that we were in. We had high agency costs throughout the year on additional medical staff, and a lot of our business case was about turning that agency spend down and reinvesting it in much more sustainable and helpful role that would complement the junior doctors we had at the time.
The strategy that University Hospital Derby and Burton decided to opt for was a practitioner that was capable of being flexible to meet patient needs, and therefore needed to be somebody with a very broad skill set.
They take on areas of advanced practice which historically might have been undertaken by medical staff, but they're nurses, AHPs, paramedics that are very experienced in their field that want to continue to develop and can offer something to patients.
My professional background is that I'm a nurse. I've pretty much worked on medical admissions units since qualifying. I'm one of the ACPs that worked. I was a ward sister for 2-3 years, and during that time I felt that actually I enjoyed being at the patient bedside, but maybe wanted to explore some management as well. So I became a night nurse practitioner. And we'll come and have a look at you, and we'll have. And I think it was that really focused my mind on actually the thing that I enjoy most is being at that patient bedside, and that's where I want to take my career, and I think that's where I want to advance my skills.
We made a decision as a trust that we would recruit into a qualified ACP post, and they would work towards that qualification, and we'd do that by 80% training on the job and 20% training off the job.
When I joined, I'd already got my assessment skills and my non-medical prescribing skills, so I was building on those in almost a sort of an apprenticeship role, working with the patients, working supervised with the consultants here, building a portfolio of clinical evidence to demonstrate my competence within these new skill areas and new knowledge areas.
We developed a framework internally, and we worked with the universities. We designed what level of skills we thought an advanced clinical practitioner should have. So there was a generic set of skills and competencies, but then there were also specialty specific ones. There's a master's programme that supports that, so the individuals have to be able to move through that master's programme. It's hugely benefited the care of patients and families. You've got a practitioner that has advanced skills, but also they've got all that sort of intuition and training that a nurse or an AHP has in relation to really advanced communication skills, working with families, working as part of a team.
Because they come from different backgrounds, although they're trained using the medical model, they bring those other skills with them that is a real contribution to the whole of the team.
One of the massive benefits that we have of having an ACP workforce is that we can move an experienced advanced level practitioner to go and work on a ward that isn't used to looking after these kinds of patients, medical patients. By putting an ACP as the support up there, they not only can help manage the patients medically, but they also provide clinical leadership and support to the nursing teams and the AHP teams. Our retention rate of our ACPs since 2004 is 93%, which is excellent. We've worked really hard on retaining them because the huge value that we get from them understanding systems and processes within this organisation, that's a massive value in terms of patient safety.
Their presence is enhancing the working life and particularly the training of the junior doctors. So it's not just about them going home on time, which was an important driver initially because of the cost to the trust, but it's about their ability, for instance, to attend training. So from a junior doctor perspective, I think they embrace the presence of the ACPs.
I think one of the challenges facing an organisation considering whether they want to establish the ACP role within their trust is that it requires to some degree a leap of faith. You need to have a sense of confidence that it will deliver the improvements that you seek, and I think it's been a real revelation to see the impact of ACPs on the delivery of our services.